From Plexus Ortho, and today we're going to discuss a very important topic, that is uh, tourniquets in orthopedics. It's a very important topic both for your theory, Viva OC, and your clinical and surgical life as well. So please let us in a short video go through what is tourniquets, what's its use, what are its complications, and how to use it correctly in our day-to-day practice. Right. So coming to a little bit of the introduction and history, what is the basic use of a tourniquet? To provide us a bloodless field, right? Where is very important, especially in foot and hand surgery, where if you have continuous bleeding, you cannot see the structures very well. Especially in the field of hand surgery, you need a tourniquet and a bloodless field. Sterling Bunnell, who was the father of hand surgery, said that it will be like operating in an ink pot. So you'll be operating in an ink pot if you do not use a tourniquet. Okay. So a brief history of tourniquet is the first tourniquet or described tourniquet was by a person called as Celsus. He was a Roman person, and about 2000 years ago first described the use of tourniquet. And I'm sure we have been using tourniquets for lots of thousands of years to stop bleeding, but the first recorded history was by Celsus, who was a Roman medical writer. Then the word tourniquet comes from a word called tourner in French, which means to turn, right? Tourner means to turn. He first used by John Louis Petit in 1718 and described by him. He was a French surgeon who was doing amputation. So the main surgery those days was amputation, and for which you need a bloodless field. And you were using what is called as it was finally called as a tourniquet, and it comes from the French word tourner, right? Then Lister started using tourniquet, and he used to use the tourniquet after limb elevation for exsanguination. So let us come to exsanguination in a later slide. Exsanguination basically can be done by two methods, but Lister popularized the method of limb elevation before for exsanguination before applying the tourniquet. Then comes the all famous Eschmark bandage, who described and used a flat rubber bandage in the year 1873, and it is to till this day it is used as a tourniquet in many centers, including rural and peripheral centers. I'm sure a lot of you would have seen the use of Eschmark as a tourniquet, right? We use Eschmark for exsanguination nowadays, yes, but in at least in my PG days we were still using the Eschmark as a tourniquet itself. Then in 1904, Harvey Cushing, right? Harvey Cushing used or introduced what is called as a pneumatic tourniquet. Pneumatic tourniquet in some ways is that same tourniquet that we use today. It is calibrated. You can measure the pressure. It is quick to apply, quick to deflate, and quick to remove. And but this has to be calibrated and maintained. So Harvey Cushing, a very famous surgeon in 1904, introduced the pneumatic tourniquet, and over a period of time this has become the standard tourniquet, and we continue to use it to this day. Now, what is the correct site of the tourniquet? You have to apply the site of the tourniquet at a site where there is maximum muscle mass, right? Why do we need a place where there is maximum muscle mass? So that we don't cause compression of the underlying nerves and other important structures. You should also not apply the tourniquet on bony structures. Why? There are some nerves which cross the bony structures, and the nerves right between the skin and the bone, and therefore can get severely compressed by the tourniquet. So by using these principles, in the arm, where do you apply the tourniquet? Or for the upper limb, where do you apply the tourniquet? In the arm, right? That is the best place where there's maximum muscle bulk of biceps and triceps. In the lower limb, you apply in the thigh, which is the place where there is maximum quadriceps and hamstring muscles, etc. are present. So therefore the correct site, the best site in the upper limb is the arm, and the best site in the lower limb is the thigh. Of course, nowadays a lot of surgeons have started to use tourniquets in the forearm and in the leg for hand and foot surgery. These are exceptions, but for your exam, the right site of application is the arm or thigh in the upper and lower limb. What is the correct size of the tourniquet? The widest possible tourniquet should be used, right? So you should use the widest possible tourniquet. Why? Because the pressure will get dissipated, and the pressure will not concentrate on a single location and cause neurological damage. It does not get concentrated. So for any given patient, be it a pediatric or adult, there are multiple cuff sizes available in the OT. you should go and take a look at them and apply the widest possible tourniquet so that the pressure does not concentrate at a smaller, narrower area. For adults in the lower limb, the ideal size is about 12 to 18 centimeters of width, and in the upper limb, it is about 7 to 12 centimeters of width. And of course, it changes based upon the if it is a pediatric age group. So, wider the cuff, the lower the pressure also that you have to put in to get a bloodless feel. For example, if you have a very narrow cuff, the pressure that is required is much higher than normal. So a wide cuff works in both ways. It requires less pressure. There's a less concentration of pressure also present. In case of lower limbs, where in the thigh, the thigh is wide, whereas distally the thigh becomes narrower. Here you need a conical tourniquet where it is wider proximally, right? It is wider proximally and it is less wide distally. So it is less wide distally. So you need a conical tourniquet so that the pressure is widely dissipated. So this is the regarding the size of the tourniquet. Now what about padding for the tourniquet? You should pad the tourniquet up to 1 to 2 layers of padding must be used. Why? So that there is no direct contact between the cuff and the skin, and this can lead to, if there's a direct contact, can lead to skin blister and abrasion. We have all seen this with our patients when we go to the OT. So you should avoid this, and to avoid this you can use 1 to 2 layers and never use more than 2 layers because it can cause reduction in the efficiency of the pressure that is applied to the thigh. So these are the two important points regarding padding for tourniquet. And the usual padding material that can be used is cotton pad. The one that we use regularly is cotton pad. Other materials can also be used, stockinette, etc. But it has been found that cotton pad is the best method for padding of the padding under between the tourniquet and the skin. Okay. Now, what about the risk of sterilization? So we have all been taught in our OT that we should always protect and prevent the betadine or spirit or alcohol or any other type of material to seep in between the tourniquet and the thigh, because this can cause burns and blisters and wounds. Burns, blisters and wounds. So you should avoid any kind of irritating material, sterilizing material to pass under the between the tourniquet and skin. And to prevent this, you can use a plastic drape to prevent it from seeping underneath, or you can use any other mechanism to prevent the seepage of the sterilization material between the skin and the tourniquet. This is also very important when you apply these tourniquets, right? Then exsanguination. Exsanguination can be done with two types. One is limb elevation, right? And the second one is by using an S-march bandage. S-march bandage. A lot of surgeons do limb elevation, where many other surgeons use S-march bandage. There is no correct, wrong, or right method to do this, right? And one important thing while applying your tourniquet is that the pressure when you apply the tourniquet, pressure, it should be less than 20 millimeters of mercury. This is hard to calibrate, but it should not be too tight. So basically, the tourniquet when you apply in the arm or thigh should not be too tight, because this can cause venous bleeding later on. So this is an important point. So this can cause venous bleeding. And to repeat, we can either do elevation for exsanguination or we can do an S-march bandage. When is an elevation really important? One, in infection cases, elevation should be done and not exsanguination. And the reason is so that we don't push the infectious material down proximally. So in infection, for example, like a flexure sheath infection or cellulitis, it is better not to use an S-march bandage, and it is better to do just limb elevation. And the second condition where you avoid S-march bandage is in case of tumors or suspected cancers, where we can cause seepage of the tumor material into the blood circulation. So in these two conditions, it is best to avoid exsanguination using an S-march bandage, and it is better to do just limb elevation. At least 2 minutes before you apply, 2 minutes before you elevate the tourniquet, you should give IV antibiotics so that it reaches the circulation, reaches the limb. So at least 2 minutes before the use of IV antibiotic, before the inflation of tourniquet, you should give IV antibiotics. Now, how long do you keep a tourniquet on, right? The upper limb, the general rule for example, the upper limb is 1.5 hours and the lower limb is about 2 hours. You can, for long procedures, you can release the tourniquet and you should wait for 15 to 20 minutes for reapplication of the tourniquet. And why should you do this? So that the wash off of toxic materials from the limb takes that longer time, right? Sometimes you may need a second or a third tourniquet time in which you have to leave the tourniquet off. The on time has to be more longer. For example, so you have 1.5 hours of tourniquet time followed by 15 to 20 minutes of tourniquet off, right? And then 15 to 20 minutes of tourniquet off, and then another tourniquet time of 1.5 hours followed by 15 to 20 minutes of this time it should be longer, right? So that's what I'm saying. Every time you inflate and release a tourniquet, so it should be on off for about 30 minutes. So this is how you should apply and take off the tourniquet if the procedure is very long. What is the pressure that you should use? The pressure that you must use is, in general, it is said in upper limb you should use about 250 millimeters of mercury, and the lower limb it is 300 millimeters of mercury. This is arbitrary. It has not been shown in science, in literature, to be the correct pressure. But sometimes some people quote anything 100 millimeters above systolic blood pressure for the upper limb, and anything and then about 150 millimeters of mercury above systolic blood pressure for the lower limb can be used. These are the two parameters, or in two ways in which you can determine the pressure that is required for use of tourniquet in the upper and lower limbs. Coming to pediatric tourniquets, of course, you should use the widest possible tourniquet which covers the limb. This can dissipate the pressure and prevents concentration of the pressure, right? So the thing that is used is, we usually use, the pressure is about 50 millimeters of mercury above systolic blood pressure for both the upper and lower limbs. This is something that is used arbitrarily again, and is supposed to give quite a good bloodless field. And you should shorten the duration of tourniquet use as minimally as possible in children, right? And the skin is a little fragile, so you should take care that the sterilization material does not seep through. So the same principles in adult hold good for pediatric, with a lot more care and attention to detail when you do it, right? The first thing is, it should be the widest cuff possible. The pressure should be 50 millimeters of mercury above systolic blood pressure for the upper limb, and maybe about 50 to 70 millimeters of mercury above systolic blood pressure for the lower limb. And the very important thing about tourniquets that we use, we are, as surgeons, when we go to our private practice, we will be using these tourniquets, and it is our responsibility and vicarious liability for these tourniquets, right? So you have to keep it calibrated, right? We would always keep on checking the pressure, make sure it is in correct, it is showing that the meters are showing correctly and we are using it the correct way. All the parts should be cleaned regularly and made sure it is in good spick and span condition. Tourniquets are the heart line of the blood line of the of orthopedic surgeries, and they should be maintained and taken care of so that we can do these surgeries without any complications. So what are the contraindications of use of tourniquets? We should not use them in deep vein thrombosis of the lower limb. Whenever a patient has Raynaud's phenomenon, it is better to avoid it. It may be relative contraindications, peripheral vascular disease. A relative contraindications is peripheral neuropathy. A relative contraindication is sickle cell disease. And the reason why you should not use in sickle cell disease, because you have hypooxygenation of the limb, and therefore the sickling can occur, and a lot of complications because of that can occur. So again, the contraindications of a tourniquet are deep vein thrombosis, Raynaud's disease, peripheral vascular disease, and peripheral neuropathy. Now, what are the complications that can occur? So complications include tissue ischemia, right? Which can also cause muscle damage. If you have used the tourniquet for a very long time, people who are very sensitive to tourniquet can have muscle damage and tissue ischemia. We can have what is called as a reperfusion injury in some cases. Prolonged use of tourniquet or some in an injured limb can cause reperfusion injury, and very rarely a syndrome which can can cause rhabdomyolysis and kidney failure, which is very extremely rare, right? And it has been clearly shown that use of tourniquet causes tourniquet pain, post-op tourniquet pain, and hypertension. For example, if two patients are operated on and one patient has not used the tourniquet and the other patient has used a tourniquet, the one with the tourniquet has more pain, post-operative pain, and hypertension for a certain period of time. And so therefore, the advantages and disadvantages of the tourniquet has to be weighed in, and the correct usage of tourniquet has to be done, and the minimal usage of tourniquet should be done. And the fourth thing is nerve damage can happen, neuropraxia can happen if you put undue pressure. The pressure, for example, the upper limb is recommended is 250, and if you use an H-mark bandage and you don't know what pressure has been applied, or if the pressure applied inadvertently is 350 or 400 millimeters of mercury, then you can have what is called as a tourniquet palsy in the upper limb. All three nerves, that is a median nerve, radial nerve, and ulnar nerve, affected. It has poor prognosis, so we should be very careful before application of tourniquet and make sure of the pressures and take it off at the right time. Right, so tourniquet palsy is another topic, and it's very easy to write a few lines about it. So it is not a difficult task for you once you've understood about tourniquets and its use. Right, very rarely forgetting the tourniquet can happen. We have heard all these horror stories in our from our seniors and colleagues. You should never forget a tourniquet. Make sure always that the tourniquet is removed on time, because if you forget a tourniquet, it can lead to gangrene, right? So these are the complications of tourniquet. So in conclusion, tourniquet is our friend, and you should know quite a lot about tourniquet so that you can write in your exams and you can succeed in your practical life as well. And I hope this small video has helped you in understanding tourniquet and helps you in writing the answer regarding tourniquets in your exam. Thank you very much.